Welcome to today's webinar. My name is Ellen Lawton. I'm a senior fellow at Health Begins. Thank you so much for joining us here to learn about housing justice, policy opportunities to prevent evictions, stabilize housing, and advance equity. Before we start, we'd like you to know that this webinar is going to be recorded, and we'll be sending this recording out to all of the registrants after the webinar. All participant lines are on mute. If you have a question for us, you can enter it at any time in the chat window. We've reserved time at the end of the webinar to answer all questions that come in through the chat. And if you can please set your chat to everyone. To test that out, can you take a moment to tell us your organization and where you're logging in from? This presentation is scheduled to last for 1 hour. Some more reminders here. Submit your questions via the chat function. We'll answer them at the end of the webinar. And then you can tweet us during and after today's webinar here. Our co-panelists as well as Health Begins. You can see the Twitter handles below. And we just invite you to bring and share your respect, curiosity, and joy in today's session. We're so excited to share some of the expertise that we have today in the Zoom room. Today, we'll get to hear from 3 experts in the field. First up, Akeem Anderson, who is Government Affairs Director at CityHealth. We'll also hear from Bethany Hamilton, co-director of the National Center for Medical Legal Partnership at George Washington University's School of Public Health. And then Rashida Phillips, Director of Housing at PolicyLink. Just a quick note about your host here at Health Begins. Our mission is to drive radical transformation in health equity by helping courageous leaders in healthcare, community, and public health, all partners to move upstream and improve the social and structural drivers of health equity for patients, communities, and society. Today's learning objectives. By the end of the webinar, we're hoping that attendees will be able to describe at least 2 policies that states, counties, and cities can implement to stabilize housing, prevent evictions, and promote access to affordable housing. Identify how health systems and plans, including Medicaid managed care plans, can support these policy reforms, and describe at least 1 action they can take within the next month to pursue a policy opportunity to prevent evictions and stabilize housing. So that you have a sense of who's here in the Zoom room with you today, we're going to launch a poll, if you can do that with Sam. And tell us what best describes your organization or association. Healthcare delivery system, hospital or clinics, health insurance plan or managed care, community-based service provider or advocacy organization, public health agency or department, or other. Just give folks another moment or two. Fill this out. Great. Thanks so much, everybody. We're almost all the way there, and appreciating folks who have also signed in on the chat and told us who you are and where you're calling from. Great. If you want to close the poll. Let me see if I can pull this over onto the screen. Or are you able to share that? Here we go. So about 25% of the audience is coming from healthcare delivery systems. About 13% from health insurance plans and managed care. About 23% from community-based service providers and advocacy organizations. About 20% from public health agencies, departments, and then about 20% other. So welcome everyone. Really looking forward to folks' comments and insights and questions today. And then finally, let's move 1 slide here. Here we go. Just want to share a major initiative directly related to today's discussion that Health Begins is so pleased to be participating in. Over the past year and a half, we've been partnering with the National Center for Medical Legal Partnership and Kaiser Permanente to integrate robust medical legal partnerships across multiple Kaiser Permanente markets with a focus on housing. Kaiser Permanente made a substantial investment to support community-based legal aid organizations, becoming the first large private integrated health system to strategically invest system-wide in MLP, adding lawyers to healthcare teams. You can see here on this slide, the initiative goals include healthier members, clinic level improvements, and healthier communities, including under healthier communities, identifying patterns and opportunities to advance policy solutions. So we're grateful for that investment, grateful for that opportunity, and grateful to point out that over $2.5 million has been invested in local legal aid organizations to be able to improve housing responses. And with that, we're going to turn the microphone over to our first presenter, Akeem Anderson. Here we go.
Thank you so much. Ellen just described me as an expert. That is quite generous and a generosity that I do not deserve. I am the Government Affairs Director for CityHealth. CityHealth is a partnership between the Beaumont Foundation. We can go on to the next slide. The Beaumont Foundation and Kaiser Permanente. We basically work in the 75 largest cities to implement a suite of policies. These are our 12 policies in the 2.0 package. And we reward cities for acting on these policies. In each policy, a city can get a gold medal, a silver medal, or a bronze medal, and depending on how many medals they get overall, they can get an overall gold, silver, or bronze medal. And the one thing that I've learned in this role is that you would be amazed what mayors will do and city council members will do for that medal recognition. So we can go on to the next slide. We'll talk today about one of our policies, one of our newer policies in the policy package, legal support for renters. I'm not going to read all the details that's in the slides because the slides are in front of you, and we'll be emailing out the entire deck to everyone. But I do want to highlight some key points and as to why we decided to go with this policy. And I know my other panelists will be going into a deeper dive as well. So we can go on to the next slide, please. One of the main reasons we decided to add this policy to the policy package, it was not in our 1.0 policy package, but it is in our 2.0 policy package, is because we are seeing we are in the middle of an eviction crisis. A lot of the supports that were in place for renters during the pandemic are now lifted. And so now we're seeing a huge number of filings for eviction. And I don't know how many of you have sat in on an eviction legal proceeding, but the cards are really stacked against renters. What you're seeing is about 3% of tenants are represented in the process compared to 81% of landlords. And if you are not represented in this process, you're pretty much being railroaded throughout the process. And so what we're looking at is trying to close that representation gap. We can go on to the next slide. We decided to pick this as an issue because it is related to public health. Evictions on their own are linked to various adverse effects on mental and physical health. And when you go through that process and then you lose your home, your access to medications, medical devices, the impact on children, they all lead to issues when it comes to both mental and physical health. We also saw that evictions are linked to a higher infection rates and death when it comes to COVID. So that's one of the ways that we've connected this to public health. Next slide, please. So when we're talking about legal support for renters, we are talking about a law that is fully funded by the state, county, or local government that ensures that all eligible tenants face eviction. The last slide that I'll show will talk about our metal algorithm, like what it takes to get a gold, what it takes to get a silver and a bronze. But this is what we're talking about, essentially a right to counsel for everyone going through the eviction process. We do not give credit to cities for pilot programs. A number of cities have introduced pilot programs, but we do not give credit to pilot programs because a pilot program is not a law that ensures all eligible tenants facing eviction have a right to a lawyer. The next slide, please. In the cities that have implemented this policy, we've seen some pretty effective changing in outcomes. People end up staying housed, and it promotes long-term housing stability. We've also seen long-term that it's used as a mechanism to help close health and racial disparities, in part because homelessness is linked to different health disparities, and evictions leads to that as well. These are one of the ways that we've been able to talk to city council members and mayors about this policy. And this is also for those cities that have implemented. These are some of the benefits that we've seen long term. We can go on to the next slide. About 90% of the time, represented tenants have avoided disruptive displacement. They've avoided homelessness. They are more likely to remain in their home. We can get a clear eviction rate record, which allows them to rent apartments in the future, and they have more time and money to vacate. It's also all of these things in place for the represented tenants also lead to positive outcomes for landlords. We constantly hear, well, what about landlords? These are good things that help landlords as well, because at the end of the day, landlords want to be paid for the service that they're providing, but also tenants have to be protected as well. So we can go on to the next slide. So I mentioned these topics a little earlier in terms of why tenants need representation. But the biggest thing that I've noticed is in my previous work, I worked for City Council in DC, and we had done some in our office. We had done some work around legal protection for renters and the housing stuff. And when I sat in on some of the eviction process and just watched it happen, like some courts will go through eviction proceedings like 20 and 30 minutes because tenants do not have lawyers in place. But having a lawyer in place allows better negotiated terms to be negotiated terms that are more favorable for tenants. You can also put in place all of the other social services that tenants may need, so rental assistance, housing search services, things that they would not have known about on their own had they not had legal representation. So we can go on to the next slide. Here are a few cities that we have seen who have legal support for renters policies in place. New York City has a really good policy, and they've estimated that they saved the city $320 million. Baltimore has a very good policy, and for every $1 invested in Baltimore, it saved the city $6.24. Philadelphia has a really strong policy that has avoided a cost of $42 million, and Cleveland has a really strong policy as well that after 1 year of implementation, they've been able to avoid between 1.8 and 1.9 million in total safety net costs. I do want to recognize that since we've been tracking this policy, a number of other cities have implemented one. New Orleans has just a few months ago passed. They started a pilot and then turned the pilot into a actual policy. They passed legislation on the council and the mayor assigned it. And so that is in place. Detroit has also passed a really strong policy. There's a ballot initiative in Denver that's happening now that could impact their policy. There's currently a ballot initiative in Los Angeles that will create funds for a right to counsel for renters in LA, but it doesn't create the actual legislation for it. So they're going about it a different way. They're creating funds for it first, and then hopefully we can work with some of the advocates in LA to actually push the council to pass legislation. I think the next slide is what we look for. Yes, our metal criteria. So at the bronze level, at a basic level, we believe that the most basic thing a city can do is have a legal support policy that provides representation for tenants. And that policy would include limited coverage. The next level for silver is a policy that would include both limited and enhanced coverage. On our website, which I think we'll link to, that'll have a copy of our housing report that covers a number of our housing policies, but also goes into depth as to like what we mean by limited coverage and enhanced coverage, and then which tenants are eligible. But the gold policy is one that covers all eligible tenants, and it includes both limited and enhanced coverage. It requires an evaluation and a policy that requires reporting. We think that it's important to have evaluation policies because cities need to know the effectiveness of these policies and whether or not they're implementing it correctly. So at the gold level for every one of our policies is a reporting and evaluation requirement. With that, I think the next slide is just our Twitter information. I do want to highlight that our partner in this program is NCCRC, the National Coalition for a Civil Right to Counsel. They've been a great partner on this. They have advocates across the country who are pushing for this policy, and it's with this moment in time, they've been able to really open the policy window and get some great policy wins for tenants across the country.
Great. Thank you so much, Akeem, for your insights and expertise. And we will be dropping links into the follow-up email and into the chat, appreciating folks who are doing that now. Thanks, Rashida. And now we're going to move on to our next speaker, Bethany Hamilton, National Center for Medical Legal Partnership. Bethany?
Thanks, Ellen. So good afternoon, everyone, or good morning, depending on where you're at. Thanks for welcoming me to present to a much broader audience what we do here at the National Center for Medical Legal Partnership, and that is really on behalf of the medical legal partnerships around the country. If I can, I just want to do something using the chat. I want to leverage the size and diversity of this audience. If you have a medical legal partnership, can you use the chat and tell us if you do? Just say something like, yes, I have an MLP. But I will be, for those of you who do not have a medical legal partnership, presenting a little bit on the definition to make sure we level set. And then I'll discuss some policy opportunities as well as successes that came up for medical legal partnerships. So we can see the chat going, and that includes our partners at Kaiser Permanente. So let's go to the very first slide in my segment today. Again, I'm Bethany Hamilton, co-director of the National Center for Medical Legal Partnership, and I'll provide just some basic information about how MLPs really are that intervention or flexible approach that really stands at the intersection of health, equity, broadly speaking, as well as justice. I just want to note that what Akeem just ended his presentation on, this movement to really expand the civil right to an attorney, right, civil Gideon. That is an effort that many have been fighting on for decades. And so it's very important to not just recognize, I think the folks have been doing this work for years and years and years, but also the opportunity that for policymakers that a pandemic, a public health emergency presented to move forward on access to justice initiatives. So let's go to the next slide. Here at the National Center for Medical Legal Partnership, we really do lead in the national space for providing training, technical assistance, advancing research and efforts by those of you who are carrying out the approach around the country, and also it's international. That really brings legal services providers, lawyers, paralegals, those who've been trained as navigators in the legal space, to partner with healthcare professionals in a collaborative manner. So often, right, when you think about lawyers, and I'll just name a specific profession, doctors, you think about the adversarial nature about our interactions. But this is a very different approach where we're collaborating to work together to identify and resolve the issues that patients face that we call, broadly speaking, as social drivers of health, or more specifically as social, economic, and environmental factors that contribute to those health disparities, the inequities that we see playing out around the country, and which have a remedy in civil law. I like to, these days, provide a footnote when I present the definition of MLP slide, as you see on the screen, and acknowledge that there's an evolution of the MLP model being carried out right now around the country. So you may have seen some of what NCMLP has highlighted recently on how folks have now begun to partner more directly with even public defenders' offices to better continue swimming upstream and better address the needs of justice-involved populations and do some of that preventative legal advocacy that MLPs get done. Let's go to the next slide. All right, click again. There's a fancy transition here. So what is it that medical legal partnerships get done? I noted, right, let's think differently from what may immediately come to mind when you hear about healthcare and lawyers. It's not about the adversarial stuff. This is about working together to address patients, individual and the population's health needs, improving health outcomes. So at the very individual level, yes, MLPs do get done that direct legal assistance to address those patients' social needs that have a legal underpinning. But what they also do is conduct trainings for healthcare workforces to really help them better improve their responses to the social determinants of health. They also take advantage of opportunities to identify and improve upon clinical level approaches and practices. And then here's where we are gathered today, talking about the policy change strategies that this particular approach, given its flexibility and ability to bring a lot of different stakeholders to the table, can get done. So that's the policy level change that MLPs get done. And it happens at various levels, big P, little p. It can happen very, very, very local, as in other words, at the organizational level. And it can also happen at the regulatory, administrative, and legislative level to affect, again, population health improvements. Let's go to the next slide. All right, so what does this look like? We use what we call iHelp as a way to think about in a framework, what lawyers can do to really help address patients' social needs. So for those of you who are familiar with MLP, you've seen and you've used iHelp before. You've probably also added on to this mnemonic a couple of other letters, but for those of you who are not familiar, the I is for income and insurance. I just want to make a note about this. At the very core of housing insecurity, we know that income matters, or something that may threaten one's income will matter and have an effect on housing. But the H stands for housing, but let's not forget about utilities. The E we utilize to describe education and employment legal issues, such as those barriers that come about as a result of discrimination or chronic disease or access to care. If the L is your legal status. So in other words, these are the MLPs that might work on helping individuals who are veterans overcome their barriers to care or to other sort of sustainable forms of income or supports because of their discharge status, or perhaps one status is an immigrant status in a mixed family, and that's what's causing the barrier to access to care or the opportunity to improve one's health. And then finally, the P is for one's personal or familial stability related to issues such as domestic violence or the need for estate planning or advanced care directives. So we use this mnemonic to describe how lawyers can really engage in the types of activities that address social needs that impact a patient's health. Before we move away from this slide, I just want to make a couple of additional notes about how this plays out even further in your housing issues. So I mentioned when describing income, right, that you can see that threats to income will impact obviously one's ability to pay things like rent, mortgages, right, or keep the bills for the utilities, the water, the lights all paid. But also in the housing bucket, you can see lawyers working on addressing issues such as substandard conditions or habitability, right? These are all the sorts of things that make whatever that shelter is actually habitable. One can actually live in it and sustain their housing or secure their housing. We also know that there are laws in place, right, in jurisdictions that lawyers can step in and help to improve if they find more systemic barriers playing out for patient populations. So for example, you may see that in a certain community, the way a regulatory structure is for utilities, we saw this play out in Texas, doesn't allow for or may disparately impact a certain population when you have what we saw like the big freeze play out in Texas. So I just wanted to highlight, right, that every single letter in this mnemonic, I help think about how these needs that lawyers can help to address, even for a domestic violence victim, that can play out and become a housing issue. Let's move to the next slide, and then I'll highlight some policy opportunities. Go to the next slide. Hopefully it's advancing. There we go. This is a graphic, and I won't read through this, but the point I want to make here is that when we talk about social determinants of health and talk about social needs, do not omit legal needs. Legal needs are a subset of social needs which impact the social drivers of health. Please do not leave out the role that lawyers and legal services providers in general can play in addressing those health harming legal needs of patient populations. Let's go to the next slide. And we do identify, this is why I'm here, MLP is one of the only and strongest interventions that helps to tackle both the individual and systemic issues, such as policies that result in health harming legal needs. So if we pause for, or we can move to the last slide in the deck, and I just want to highlight a couple of ways that medical legal partnerships have been active in this policy space throughout the pandemic. We're in that endemic mode now. We saw, speaking of Texas, the MLP team at People's Community Clinic and Texas Legal Services and Texas Health Action work on emergency rulemaking to be able to prevent, the utility shutoffs. The legal health team, a division of NILAG in New York City, worked to expand standby guardianships so that anyone exposed to COVID-19 would be able to take advantage of those regulations. And then finally, we saw MLPs around the country prove the point that we'd all been trying to make, that if you don't stabilize housing by putting into place those moratoria, and of course, what we saw through civil right to attorneys around the country, you won't be able to address the spread of COVID-19. And so we definitely want to thank and acknowledge the medical legal partnership practitioners, researchers, and those in the advocacy space that managed to make and secure those policies for a very long time. And some of them are continuing into 2023 quite successfully. The ability for medical legal partnerships to get this sort of work done really depends on stable financing and funding of their work. Many of them work with they piece together various finances and forms of funding to sort of create an MLP pie. And the only way they can continue to get this done is truly by ensuring that we leverage those policies such as Medicaid financing, Medicare Advantage, the MCOs, right? All of the various stakeholders who have an interest in the work that medical legal partnerships come together to do, tap into those financing streams and support the work that they're getting done. And we did see Congress take action, bipartisan, last year through HR 3950, trying to get the Veterans Medical Legal Partnership Act passed. And we also saw last year, linking seniors to needed legal services, also bipartisan support. That's HR 5241. Come through the Build Back Better Act. Unfortunately, that didn't move forward, but I'm noting that, those were opportunities I think that we should continue to see. Those were very, very much. Some of the very first times we saw MLP specifically make it that far through legislation at the congressional level, and we're going to continue to build on that momentum. And we're hoping that some of you, even in the health plan space that are online today, can help us support some more of that work, both at the federal level and at the state level. With that, and I know an MLP is also on the panel, patiently waiting to speak. I just want to thank you all and let me know if you have any questions. I'll keep an eye on the chat.
Great. Thanks so much, Bethany. Appreciate that. And now our final speaker, Rashida Phillips. Thank you so much for hopping in with your portion. Look forward to your remarks.
Thank you so much. Yes, can you hear me okay?
Yeah.
Okay. Hi, everyone. My name is Rashida Phillips. I am Director of Policy. Director of Housing at PolicyLink. PolicyLink is and you can go to the next slide, please. PolicyLink is a national research and action institute advancing racial and economic equity by lifting up what works. And we serve the 100 million who are at or below the poverty line, most of which are people of color, Black and Brown, and Indigenous households who are facing poverty. Next slide, please. So prior to coming to PolicyLink, I served as a attorney at Community Legal Services of Philadelphia for a long time. I represented tenants who were facing eviction, as well as displacement, tenants living in all sorts of housing circumstances. And coming to PolicyLink, my role is a little bit different in this capacity. I am mostly focused on the housing policy and how we think about our mission in terms of housing. We have three broad principles that we think about. So we center people, not profits. And this means that we are pushing for the robust supply of permanently affordable community-controlled housing, pushing for strong protections for low-income renters, homeowners, and other marginalized people, and working to align and activate grassroots networks and advocacy organizations on transformative policies and narrative work to reshape the housing market. We also believe that shifting power in housing markets and governance allows us to win on equity. So that means that we're looking at deep public sector investment in and commitment to housing for all. Low-income people and people of color and others who have been marginalized are organized and are shaping the housing market systems and policies, and that we'll see reduced corporate power, speculative activity, and commodification of housing. And then finally, winning on equity for us means supporting healthy communities of opportunity for all, which means the elimination of longstanding patterns of housing segregation, discrimination, and disinvestment, as well as increased spatially just places that provide access to just and equitable housing futures. Next slide, please. So what does that look like in practice? What transformative housing policies meet that winning on equity standard? So I'm not going to focus on land and development. I just want to focus on the housing policies that are named here, many of which you heard from the previous panelists. And so for us, the ones we're focused on at this time are increasing housing access. So we're looking at tenant screening reform, particularly for folks who have faced eviction, for all the reasons that were talked about earlier. They often walk away with eviction records that can be used into the far future to deny them access to healthy and safe housing. So we're looking at a lot of policies around tenant screening reform, some of which we were able to do in Philadelphia. For example, last year before I came to PolicyLink, we were able to get a law passed called the Renters Access Act, which sets parameters around how landlords can access and look at eviction records and how they can be used in screening decisions. And so we're also working around affirmatively furthering fair housing work. I'm not going to have time to get into that rule today, but just generally, the AFFH is a federal rule that it advances the Fair Housing Act and requires cities and jurisdictions to take affirmative actions to further access to safe and fair housing. And then also we are uplifting policies that increase housing stability. So some of the ones, again, that you heard earlier, things like right to counsel, eviction diversion, just cause eviction, rent stabilization, and looking at all the ways that these policies support each other, right? So when we're talking about something like right to counsel, it is a policy solution, but it often can work best when it's paired with other types of solutions like eviction diversion. And I saw someone in the chat mention a question about things like moratoria and how they impact small landlords. Programs like eviction diversion, which is often designed to help both parties be able to access services and resources so that people aren't being evicted and having to deal with disruptive displacement. And so looking at those policies, not just the policy themselves, but how they work together to increase housing access and decrease housing instability. Next slide, please. For us, it's also necessary to interrogate and think about, right, if we're going to try to achieve transformative systems change, transformative structural change, we have to interrogate the values that are underlying how we approach our housing advocacy work. And so I'm also an artist and an Afrofuturist. And so I bring that lens into my work. And at Policy Link, we have developed a platform called the Housing Futures Platform, which is basically us uplifting that housing is a foundation for building health, where families and communities can thrive, and where our experiences can be liberatory, where those housing futures, right, can belong to everyone. And that this means bright and bold and new models, right? Not just the same models, not the same approaches, and not just tweaking the system, but really coming up with new models that are unapologetic in terms of their inclusivity and made possible by the brilliance, insights, and guidance from the communities who are most impacted by housing inequities. Next slide, please. So these are some of our guiding considerations for that. We think about how do we apply liberatory frameworks like abolition and Afrofuturism to housing and land justice that can help us produce these new models. How do we invoke the spatial and temporal imaginaries, the space and time orientations of Black, Indigenous, and Brown folks to really imagine new worlds, new possibilities, and then reimagining in ways that we collaborate and co-develop with impacted people and communities, right? Not just checking the box and having a couple of meetings and thinking that we did our job in terms of getting their input, but really sitting down and co-developing the solutions outside of the crisis response model that's going to have us achieve new and bold housing futures. Next slide, please. And then in support of that, how do we make change happen? And again, this is just reiterating a lot of what I said earlier, but want to emphasize, right, that includes aligning and activating grassroots networks, people most impacted, advocacy organizations, and leaders from across the housing and land justice sector. And even that, for me, is too limited, right? We want to activate across all sectors because we all have a role to play in housing and in health and transformative policy change. And then providing the policy research data and partnership backbone to strengthen the power and effectiveness of the housing and land justice movement. And finally, harnessing the power of narrative. Narrative shift and narrative strategy is integral to our work in order to understand, interrogate, and shift power and political will. And then my last slide, please. What change can look like. And so when change happens, when we're really, again, leaning into these new models, leaning into, a framework where we're co-developing solutions with people, it looks like impacted people and organizers who are leading the housing and land justice movements with more visibility and leadership of Black intergenerational people with lived experiences of housing insecurity and equipped with the best solutions and strategies to address those issues. So in that picture you have, that's listed on the slide, you have the Philadelphia Tenants Union a couple of years back fighting for good cause eviction. And so just showing, right, the folks who are most impacted, these are people who were evicted, who were pushed out of their homes for unjust reasons, and who were activated to push for protections in Philadelphia. And without their work, we wouldn't have all of what we have today in Philadelphia in terms of progressive housing policies and protections. And then creation of infrastructure, policies, and resources for the creation, preservation of affordable housing, community-controlled land. And then finally, increase visibility and priority of housing issues through a racial justice and equity lens in policy development and resource deployment. The other that I'll mention is that same thing with Right to Counsel in Philadelphia, which just got implemented earlier this year, but it was a 5 or 6 year fight. And that fight included, it wasn't just housing advocates and people who are already, sort of in these positions already providing representation, right? But we really needed a strategy that looked a lot like how New York City did its Right to Counsel movement in centering and uplifting the leadership of the people most impacted, right? In order to make permanent change, because if you're talking about something like Right to Counsel, often what people hear, city governments hear is, oh, you just want more money to have more lawyers, right? But what we were really after was transformative change, change that could address the inequities in the housing system, in the housing court, which disproportionately impacted Black and brown families. And again, in order to do that, top down, bottom up, transformative change from all directions, you need to have the people who are most impacted at the leadership table, building that table, part of that table. So I will end it there because I know we have some questions and things that we want to get to, and I really appreciate the time. Thanks.
Oh, here we go, unmuting myself. Thank you so much, Rashida, for those insightful comments. And we are going to move right into our Q&A. Let's see if we can just fireside, or as some of us say, wireside chat opportunity. We've had some questions that have come in, but I do want to kick off with each of our speakers. I know you've spoken to this in different ways, but if you were going to give specific advice today to a health leader over coffee or over a Zoom about the way that their institution can support local policy efforts to prevent evictions, like what would you say in a couple of sentences, right? What would be your particular, right? You each came in with a vantage point and some really great data and resources and insights. But just wanted to give each speaker that specific opportunity to provide specific advice to a health leader who said, why should I support local policy efforts to prevent evictions and protect renters? Anyone else want another? Go ahead.
I guess I can start. So everything in our policy package we picked because local government has say over it. And we believe that because local government is closest to the people, they are most effective in doing this work. I would argue that health leaders must get involved in this advocacy because if these are not addressed on the front end, health leaders are addressing it on the back end. And that's the conversation that we have when we work with public health directors about our policies. That's the conversation that we have when we talk to law enforcement about our policies, when we talk to educators about our policies, when we're talking to anyone about our policies. At the end of the day, if these things are not addressed on the front end, then they show up in their workspace.
Right.
Exactly. In a different version of this presentation, we talk about the pathways, the 4 pathways by which housing affects health. And so some of those consequences are increases in mortality, depression, anxiety, drug and alcohol use, disruptions to employment, right? Of course, you can't get to or even be able to focus on your work or get to your work setting if you have a very basic core need and not shelter and housing. You can't even apply for a job without an address to include on the application, right? So, it's showing up in the exam rooms. It's showing up in the EHR, it's showing up in those vital signs. And, as you continue to screen for the social needs of your patient populations, or, for those of you in public health, if you're a legal epidemiologist, right, it's showing up in the data. And so I know, at least for the MLP approach, it is flexible enough so that those partners are already coming together, figuring out, what might be the systemic problems that are at play and can be addressed. And oftentimes it's a policy barrier and a policy solution. So yeah, I mean, just echoing what Akeem said, just also plugging the MLP approach.
Yeah, and I don't have much to add to my co-panelists. I would just say that health providers and health workers are needed for co-design, not just as consultants, but needed like when we are actually writing and designing the policies, we need you there. We need you at the table, often to test the reality of how this policy is going to be impactful around health areas and some of the realities that you all face that, us on the legal side may not have a perspective into when someone's coming into your office and giving you specific details around how their housing circumstances are impacting their health. So we need that perspective. We need those realities. We need to be able to test against. And so we need you all for co-design of these policies.
Great, thank you so much. Really helpful responses. I'm going to post up here some of the other questions that we had talked about and that have shown up in the chat, sure enough. And then we have some other questions that have also shown up in the chat. But one question that came through is to talk about the capacity of the legal sector to handle the increase in work that a right to counsel creates. And I see that in the chat as a concern in New York, and certainly we've seen that in some of our work. So anybody want to tackle that, Rashida? You're nodding your head.
Yeah, absolutely. It's a huge problem. I won't I won't hide the ball here. It is a huge problem in terms of capacity. And I think the first generation of right to counsel programs, right, we were really excited about pushing and advancing the policy and thinking a lot of things would fall into place. But then the realities of, once these policies were in place and began getting implemented in terms of not being able to staff up quickly enough. Once we do staff up quickly, once we do staff up, even still the caseloads and the capacity are issues that are out of sync with, what a legal services program may be able to handle or take on. So I think people are looking at that. And I think this second generation of right to counsel policies that are coming after the pandemic have these first generation folks to lean on and are testing and making sure that they're designing with this in mind. But it is a problem. And I think it's also one that we need to think about how we involve law schools, how we look at the pipeline from start to finish, right? We can't just look at right now, and we need attorneys right now, but we need to look at 5 years from now. We need lawyers who are going to be coming out of law school to be able to be working on housing right to counsel programs and thinking about it we don't want to necessarily have it look like a defender's model, right? But the capacity and the ethos that are a part of a defender's model, having that become a part of the legal services right to counsel model. And it also just takes a lot of partnership, right? It's not just about, again, attorneys and it's paralegals. We need everybody on deck with these things. And like I said earlier, sort of when you can pair these policies together. So in Philadelphia, for example, our right to counsel program is integrated with our new eviction diversion program. That can help with some of the capacity issues, right? Because the diversion program is ideally lessening the flow of cases that go through court if you can resolve it pre-court without incurring an eviction record as well, right? So it also helps with that situation. So I'd be happy to talk more about this. And what I did not mention is that National Coalition for Civil Right to Counsel, which Akeem mentioned earlier, PolicyLink is also partnering with them in Results for America. Currently, right now, we're doing a 10-week right to counsel sprint with 10 cities and states around the country to help them develop these programs and paying very specific attention to all of the issues that you all are mentioning around capacity.
Great, thank you so much for that. I'm gonna move on and again, capturing, questions in the chat that sort of align with the questions that we shared here. There's one question, are there examples of model Medicaid MCOs that have successfully helped support different housing policy reforms? And again, I think this is for any of the panelists.
Sorry, Ellen, just to clarify, for health policy reforms, I think—
I'm sorry, not policy, housing policy reforms.
Yeah, so I think it's important to note, and it's someone similar that asked the question, right, in a chat, about how to support MLPs. And I think it's really important to, recognize that, many of the health plans have really stepped up to the plate and said, here's exactly what we're going to be doing in health equity. Many of them with their policy shops and advocacy shops weighed in on changes related to, NCQAs, health equity requirements, really pushing for that because they know that that would benefit their bottom dollar, quite frankly, for the beneficiary or member pool, if you're talking about Medicaid, for them in various states. It also strengthens, as they look at RFPs in various states, it really strengthens their proposal to state Medicaid agencies when they can show, through concrete proposals, how they're going to meet the state's requirements, which include not just access to the Medicaid population, but also improving their health outcomes. And that we can't ignore that has to address the social determinants of health. So I just want to note, it's big P, little p policy, but those are just, I think, at the very high level, a couple of the ways that we've seen MCOs take part. And then there are various examples that we have where we can highlight states where MCOs have directly supported interventions like medical legal partnerships through things such as simple as grants, or even in California through the whole person health 1115 waiver, directly engage with MLPs and legal services providers at that contractual level.
Yeah, I do want to uplift, and I see it was just mentioned in the chat. Kaiser is a 50-50 partner with the Beaumont Foundation, CityHealth. They've been a thought partner in how do we engage city leaders around our entire policy suite. And they've been a valuable partner in implementing these policies across, especially the places where they have a footprint. So that's an example that I would look to. I think that's a model that other healthcare providers could easily replicate.
Great. And it takes resources, right? And so it's on the partners to identify what those funding streams are, either at the outset or also planning ahead for how they document what sustainability actually means. And so lots of different funding mechanisms and lots of different ways to describe the work and the impact that each of you have shared in terms of making the case. Right, it sort of depends on what the funding mechanism is, and also what the leadership is equipped to tackle. And so, I think there is room for lots more leadership in this space, particularly in the MCOs and healthcare systems. But there's lots of great work also happening currently. So, great. Couple of more questions. We have some time. I'm trying to keep track of the questions coming in here through and appreciating folks sharing links and cost benefit analysis types of information that's coming through. But I wonder also if, Bethany, if you want to just take a moment to talk about funding for medical legal partnerships briefly, or drop some resources in the chat there. That was a question that came through in the chat.
Mm-hmm. Yeah, I've been trying to weave it into a couple of my responses, right? Noting how, health systems have, I think, stepped up to the plate and worked directly with medical legal partnerships around the country, Indiana, California, and several other states, right, to directly support legal services, including through, this is part of our, partnership with Health Begins and Kaiser Permanente, is to really help that health system directly support medical legal partnership in several of their markets. And we can see other examples, AmeriHealth Caritas in Philadelphia and DC and other places really similarly work to directly support medical legal partnership. And many of those are focused on, because the approach is very flexible, they focus on housing and homelessness. But they also recognize, right, that they, through their support, they're able to also uplift and highlight the evidence, right? And so I think, one thing to consider if you're in the health plan space is that what you have the capability to do with your data, right? You have these closed data sets, and you also have the folks who can actually, like actuaries and data scientists, look at that data and do risk identification and stratification. And so this is the next space for social determinants of health interventions, is figuring out how to leverage these limited resources and target them to the right people, the right place at the right time, so that you can, so the resources are limited, right? The people resources, the monetary resources as well. So, another thing I'll just plug is that if you're in this space where you are able to harness the data, as you think about ways to support medical legal partnerships, also think about ways to support the research, the building of the evidence base, because oftentimes in that policy space, as Akeem and Rashida know, you've got to show the data to back up what you're requesting and what you're asking for.
Thanks for that, Bethany. And just again, call out to the investment that Kaiser Permanente has made in evaluating the MLP implementation, which is substantial and really critical to tell that story about the impact of not just at the individual level, but what will the ripple effects be of incorporating lawyers as part of the healthcare team for boosting the knowledge. And Rashida, you spoke to some of this in your comments, the knowledge that case managers and other healthcare team members have around housing and boosting their understanding and really capacity to tackle housing on their own because they have access to that specialist, that expert, the lawyer, to hopefully prevent rather than treat the acute case of housing issues that get presented. So I think that evaluation facet is really critical. And but we also have heard today from all of our speakers that there's a lot of evidence already in place that tell us what the challenges are, where the challenges are to be found, and then what are some of the solutions that we can implement. And so I think our job is to bring those solutions more directly to health and health systems and get them on board with it, the advocacy that needs to happen in the resource building that needs to happen in that context. So we're coming up on our time, closing out our time together. I don't know if we have any final comments or haven't tracked on the chat here if there was a need for a final comment or question, but we're
Yeah,
yes,
if I can, Ellen, I just want to acknowledge the audience, right? I always do on, our NCMLP webinars, but this is, I think it was over 500 that registered, and the live audience is, over 225 folks who stepped away from their day-to-day to say, what can we do to really create systemic change, right? What can we do to make the investments? And so kudos to you all. Thank you so much for taking the time to hear more about at least what we think, can be done. And I know for me in particular, I'd love to hear from the field about what you are getting done and what we may have missed. But I just want to acknowledge that, that this is a sign of, I think, the momentum moving in the right direction to create systemic change.
Right. Beautifully put. Thank you so much, Bethany, for that. And kudos to our audience. And we're just beginning the conversation. So please do complete our follow-up survey, which will appear in your browser after the webinar ends. Share your favorite moments on social media and tag us when you do. Tag our expert partners and panelists. Take action, and we hope that you do, and we hope that you let us know when you do. And stay engaged with us and with our partners here, learning about CityHealth and Policy Link and National Center for Medical Legal Partnerships so that we can move forward together. So look forward to seeing you again in this space and really appreciate your time and energy and conviction. Thank you so much.